Good day, everyone. I'm Dr. Wilfredo Santos, a professor in the Department of Pediatrics of the De La Salle Medical and Health Sciences Institute, and I'm here today to talk to you on the 10 physiologic changes in the newborn. It is important to differentiate these physiologic changes from pathologic changes noted in the newborn during the first 72 hours to 1 week old. The objective of this lecture is for you to recognize physiologic changes commonly seen among the newborns. And these are the 10 physiologic changes: physiologic weight loss, physiologic jaundice, physiologic anemia, dehydration fever, witch's milk, pseudomenses, falling off of the umbilical cord, the passage of meconium, the transitional stools, and skin desquamation. First is the physiologic weight loss. There is a 10% physiologic weight loss among term infants and almost 15% among preterm infants, and these are due to the following. First is the contraction of your extracellular fluid, then the passage of meconium, the removal of the vernix caseosa, which is the cheese-like substance in the skin of the newly born baby, which is needed for thermoregulation, and lastly, the passage of urine. Next is the physiologic jaundice, believed to be the result of increased bilirubin production due to the breakdown of the fetal red blood cells combined with transient limitation in the conjugation of bilirubin by the immature neonatal liver. Jaundice becomes visible on the second to fourth day of life and decreasing to below 2 milligrams per deciliter between the fifth to the first week of life. Physiologic anemia, and this is due to the progressive decline in hemoglobin levels during the first week of life because of the shorter lifespan of the fetal red blood cells, and which may persist for 6 to 8 weeks. You don't need to do blood transfusion for babies with anemia due to physiologic causes unless they have the symptoms of tachypnea and tachycardia or with decreasing oxygen saturation. This is also due to the suppressed erythropoiesis, which is noted during the newborn period. The next physiologic change is your dehydration fever or your inanition fever, which is an elevation in the temperature of babies usually noted on the second and third day of life due to decreased caloric intake brought about by the decreased breast milk supply during these days. Infection in the newborn usually is manifested with hypothermia than hyperthermia, but you have to rule out infection when the baby has fever. This is also due to environmental factors such as overdressing of the baby, or when the baby, especially the premature babies, are inside the incubator, or when there is too much sun exposure. Next is your witch's milk, wherein there is bilateral breast hypertrophy occurring among male and female babies, and this is brought about by elevated circulating maternal endogenous steroids hormones in late gestation. This is associated with whitish breast milk like discharge from the nipple, as you can see in the picture. Next is your pseudomenses. The genitals of female newborn respond to transplacentally acquired maternal hormones to produce in their genitals this discharge. Usually this is non-purulent, associated with whitish red tinge secretion. Next is your falling off of the umbilical cord. The umbilical cord falls off between 10 to 14 days among full-term babies due to the action of inflammatory cells. Among preterm infants, it may be delayed after more than 1 month due to defects in neutrophil chemotactic factors. Next is your passage of meconium, which usually occurs within the first 12 hours of life after birth. 99% of term babies and 95% of preterm infants pass meconium within 48 hours of life. Non-passage of meconium rule out imperforate anus and Hirschsprung's disease. The next one is the change in stool color from black meconium to greenish to orange-yellow colored stool, which is due to the contents of the breast milk. And then the last is your screen desquamation, which is due to the shedding off of the fetal epidermis, and this can also be due to the reaction of the fetal or the baby's skin to the external environment. In summary, these are the 10 physiologic changes commonly seen in the newborn, and you as a clinical clerk should recognize them. Any deviation from this may mean another condition like sepsis or congenital problems in the newborn. Most of these physiologic changes will last only for about 7 to 14 days. Thank you very much for your attention.